Hello, my name is Hyung Shin, the head of Basgenbio's global business team. Let us start our company presentation. Basgenbio started its business in 2018, and we can proudly say to have the largest clinical genomic cohort database in South Korea, known as K-Biobank. The K-Biobank project began in collaboration with Yonsei Medical Center in 2005, collecting blood samples from 156,000 Korean subjects who are in a healthy condition without any severe diseases at the baseline. To date, genomic tests have been conducted for 90,000 subjects, which accounts for 58% of the total individuals. Since the collection of blood samples, the clinical records, demographic information, and lifestyle data of these subjects have been updated every 2 years under the governmental data system by the National Health Insurance Service, National Cancer Center, and Statistics Korea. To date, 23.4% of these subjects have been diagnosed with different types of diseases. When you see these graphs, you'll notice that there have been more than 8,600 cancer events and over 75,000 major chronic disease events. As the number of cases increases over time, the value of K-Biobank, our clinical genomic cohort database, also increases. K-Biobank has two comparative strengths. Firstly, we use K-chip, developed by the Korean CDC, for conducting genomic tests on subjects from K-Biobank. When comparing the number of variants among different types of genotyping chips, including the UBA chip used by the UKB, and the GSA chip used by 23andMe, K-chip has 2 to 3 times more variants, especially pathogenic variants, as well as non-synonymous insertion and deletion variants. In addition, the follow-up rate for K-Biobank exceeds 90% because of its inclusion in the governmental tracking process, while the follow-up rate for the UKB is less than 10% according to our findings. Leveraging our clinical genomic cohort data, we offer two primary services to our clients: biomarker discovery and drug efficacy simulation. Biomarker discovery entails identifying predictive and diagnostic biomarkers before and after disease occurrence, while drug efficacy simulation provides 4 different types of solutions to our clients for their drug discovery and development. Predicting drug efficacy is a crucial factor in minimizing attrition during drug discovery and development. For biomarker discovery, we have developed a system called TLBM, Time-Labeled Biomarker. Our biomarkers offer comparative advantages over existing models provided by other companies. While conventional biomarkers merely provide odds ratios for disease occurrence, our biomarkers provide comprehensive information on the specific periods in an individual's life when they have a higher chance of developing a particular disease, along with preventive measures. To provide precise information and analysis to our clients, we've integrated and standardized other global biobank data, including that of the UK Biobank, TCGA, the Cancer Genome Atlas Program, ADNI, Alzheimer's Disease Neuroimaging Initiative, and more. We have established pipelines for predictive biomarkers for cancer and cardiovascular disease, with plans to add pipelines for autoimmune disease and metabolic disease this year. Last year, we licensed out the gastric cancer biomarker to a molecular diagnostic company in Korea. The core technology we use for drug efficacy simulation is AI-based Mendelian randomization, MR. It is highly recommended to conduct MR studies before initiating actual randomized trials to identify the effects and side effects of long-term drug usage. We've developed our own unique AI-based MR technique and use it for drug efficacy simulation. This is the framework of our drug efficacy prediction. First, we discover druggable genes for specific diseases. Then we identify drug candidates and examine their efficacy. The graph shown here represents a case where we simulated the efficacy of a type 2 diabetes mellitus drug. In addition to predicting the efficacy of a single drug, we also investigate drug combination effects. The graph displayed here showcases one of our drug combination cases. if a specific drug has a side effect, and if that side effect is positive, we can consider drug repurposing. The graph presented here demonstrates an actual case of drug repurposing. If a drug shows no response, we investigate the genetic codes. If there is a difference between the responder and non-responder groups, we proceed with the discovery of target genes that are druggable for the non-responder group. If our clients have novel target candidates, we can assess both the effects and side effects of the drug candidates. Additionally, we can identify the effects of drug combinations and repurposing for existing drugs on the market for our clients. If there is a non-responder group, we can identify novel target genes for that group and assist our clients in developing new drugs specifically for them. Lastly, if our clients want to discover novel target candidates, we offer a turnkey solution that starts from target discovery and extends to identifying drug effects. And this is the analysis outcome we came up with last year. We conducted analysis for diseases including CVD, obesity, Alzheimer's disease, heart failure, and stroke. For instance, we discovered that bempedoic acid has a significant effect on CVD compared to other drugs, while a combination of fluoxetine and topiramate is significant for obesity. In addition to these achievements, based on our own clinical genomic cohort data, we've been building biobank consortiums for aging-related diseases, rare diseases, and alopecia. This collaboration involves global and domestic pharmaceutical companies, medical centers, and national associations in Korea. We are currently engaged in discussions with a global pharmaceutical company about the concept of a virtual biobank as well. This ongoing idea aims to build a virtual biobank that can predict missing phenotype data based on individual genotype data, including EMR data. If any of these biobanks and ideas interest you, please feel free to reach out to us for more details and in-depth discussions. This concludes our company presentation. Thank you for watching.